tres, sí, 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 sí. The reason why I do this, you guys, is because my auto sucks and it takes a while for it. It goes.
I get the feeling, girl, you need someone who love and appreciate.
Hi you guys, welcome back to my channel. My name is Araceli, aka Chelly, and today on Chelly's Mental Wealth, we're going to be talking about panic attacks, aka panic disorders, okay? In regards to this topic, what I'm going to explain to you guys is what's the difference between a panic attack and an anxiety attack? What exactly causes an anxiety or panic attack in general, right? What happens to our bodies as to why this occurs? And the biological theories as to what my abnormal psychology explained to me as to why this occurs. I'm also going to be discussing certain treatments that a person who's dealing with any panic attacks or panic disorders that they can implement if they're seeking therapy, or maybe if they're thinking about it, this can actually help them have a sense of relief that there is hope that you can take control of your panic attacks and completely stop them. It is possible, you guys. It just takes a lot of work. I'm also going to be giving a couple of tips for someone who wants to help someone that's dealing with panic attacks, because I think it's important that whoever is around you, or if you do know someone that's dealing with this, you can be as supportive as you can, because the more support the better. But do not get discouraged, you guys. If you don't have the support, you can do it. It is possible, okay? Now let's get this started.
Alright.
What is the difference between a panic attack and an anxiety attack? The main difference that I keep seeing over and over and over is that when you have a panic attack, it happens abruptly. It happens for no apparent reason. There's nothing that's scaring you. It just comes and goes as waves. And in order for it to become a disorder, it needs to be happening a bunch of times throughout the day for no reason, or it has to happen for a lot of days throughout many weeks, and then it stops and you have a break, and then it happens again many weeks, once a day. It just keeps happening abruptly. That's one of the main things. And also too, that when you're having a panic attack, you feel like you're actually going crazy. You feel like you're about to die. You feel like you can't breathe. You feel dizzy. You have derealization. So once it gets to that level, you're already having a panic attack. And once it occurs continuously over and over and over, even for no reason, is when it becomes a panic disorder, okay? Now, why is it that our bodies can create this disorder? And the reason is, when we have anxiety, we trigger our amygdala, right? Our amygdala is constantly thinking we're in danger, and the amygdala gets all wacky-dacky because your anxiety is getting triggered because of whatever trauma you're going through, whatever is causing that anxiety, whether it's big or small, traumatic or not, it's causing that anxiety, right? So that anxiety keeps going and going and going, which is triggering your amygdala to a point where you turn on that switch and your amygdala is always alert. They're just gotta be careful, making sure that thing's not gonna trigger that anxiety. Now, because you're constantly focusing so much on your anxiety, it could then increase your chances to having a panic attack disorder. So it's all connected, you guys. It's all connected. So if you take control of your anxiety, you won't have that many panic attacks or develop panic disorder. Another theory that they mentioned was that panic attacks get developed off of modeling behaviors, like watching their caregivers, watching family members develop or have panic attacks, and as their coping mechanism, so they learn those skills, or they think that that's the proper way of dealing with stress, that they end up having panic attacks all the time because that's what they saw, that's what they learned. Stress is also a main trigger towards panic disorder or panic attacks in general. Making sure that you really take control or very aware of your stressors so that you don't eventually end up having panic attacks for no reason. So stress, you guys, stress. I can't stress it enough. Stress. Don't focus on stress. Another reason that they mentioned was that biologically, it was really interesting what they said. And they said that when your amygdala gets triggered, right, like how we talked about, it sends a signal to a certain part of your brain. And this signal is called the locus coeruleus. I'm sorry if I'm butchering the word, but I am going to be putting it on the screen so you guys can understand what I'm saying. And Basically what it says is that people with this disorder also show dysregulation of narrow peripheral system, sorry if I pronounced that wrong, you guys, in an area of the brain stem called locus coeruleus. I don't even know if I said that right again. But like I said, I'm gonna be putting it on the screen, you guys. But yeah, basically they're saying is the poor regulation pretty much messes up that part of your brain, which causes you to create more panic attacks. It's like a truffle effect, and that's pretty much what they're explaining. One thing that they also said was that 25% of people go through a panic attack, okay? But there's about like a 5 to 3% of the population where they'll develop an actual panic attack disorder. But like I mentioned, it is possible, you guys, to take control of it. Now I'm gonna go into how you can take control of that. In order for you to take control of it is obviously doing medication or doing cognitive behavioral therapy, which is basically kind of like what I do. Because when I read into it, it gives you step by step as to how the clinician is supposed to help you conquer your panic attacks. And what was crazy is they did a study comparing medication and cognitive behavioral therapy, and it resulted that cognitive behavioral therapy was a lot more successful than taking medication if you're on top of it and you're continuously practicing your coping skills to kind of take control of your attacks. So it is possible, you guys. Now I'm gonna go step by step as to how the therapist should help you during the time that you are having sessions if you're dealing with panic attack disorder or attacks, okay? And first, what they say is that the clients are taught relaxation and breathing exercise. Basically what she's saying, let's review what coping skills may or may not work, kind of like what I do with you guys, right? Figure out what works for you. It really depends on your personality. It really depends, you guys, and that's why I always suggest many different types. Maybe it's reading a book, maybe it's having a spray bottle, like I said, right? Putting the spray bottle. If you need to spray some water in your face to help you calm down and realize like I'm not in danger, I'm okay, get yourself a spray bottle. If you need to go to the restroom and splash your water, go in the restroom and splash your water. Another suggestion is if you need to go to the car, do some meditation, pray, whatever's gonna actually help you calm down. Talk to yourself in the car privately to help that panic attack go down. I know that that's what helped me. I got a panic attack when a cockroach was on my chest. Oh my god, I was so scared, you guys. It was the first time I really just pooped my pants, and I was hyperventilating, breathing hard, crying, and everybody was really shocked that I was that scared. And that's when I realized, like, wow, like I really need to learn how to control my panic attacks when I see a cockroach, so that if something bad would happen, like the end of the world, what am I gonna do? I'm not gonna survive. So that to me was enough of a reason for me to, like, every time I see a cockroach, I still freak out, but I just look at it and I'm like, I'm okay, I'm okay, I'm okay. And it's helped, you guys. I'm not gonna say that it might be the same or not, but I know I'm scared. Like I don't think I can really describe that feeling. Like I was breathing, I was crying. I didn't think I was gonna die, but I think I was having a panic attack, or an anxiety attack, but it was really horrible. But I know that helped a lot. So figuring out what works for you. Maybe praying works for you. If you're really connected to your religion and you're very spiritual, maybe you need to meditate. Meditation works wonders, you guys. I don't really talk about meditation that much. And imagine if you meditate every day, you're teaching your brain those new skills to be like,
meditation, you guys. Do it. Try it.
And it just takes a lot of effort and dedication. I almost skipped the steps. So yes, you practice your coping skills, right? You identify what's going to work. Now, secondly, the clinician guides the client in identifying catastrophic cognitions that have about changes in the bodily sensations. So they're pretty much teaching them how to be more aware, self-aware about like their senses. And it's stuff that I usually do with my clients too. Thirdly, the clients practice relaxation and breathing exercise while experiencing a panic symptom during the session. So it's reinforcing that coping skill while you're having a panic attack is exactly what I do with my clients. Fourth, the therapist challenges the clients' catastrophic thoughts about their bodily sensations and teaches them to challenge these thoughts themselves using the cognitive techniques they described. Practicing with them, and she gives them homework to ensure that they continuously do this coping skill, and then I'm assuming that if they challenge them, that they do it a lot. You know, they go out in the community and they practice these coping skills during these panic attacks. So fifth, the therapist uses systematic desensitization therapy to expose clients gradually to the situations they fear most while helping them maintain control over their symptoms. So basically, this is like exposure. It's an exposure technique, like going out to the community. You know, some people can experience panic attacks when they're out in large crowds if it's something that is their own trigger. Exposing them continuously and practicing those coping skills will help you tremendously, you guys. Most of my clients that I did receive in the first few years working with the nonprofit organization, I had a lot of clients dealing with anxiety, and practicing reviewing things with them as to what caused them to have a panic attack is really important, which is something that you know they explained here. And by exposing and practicing and doing it over and over and over, it's gonna get easy because you're building those skills and you'll be able to take more control of those attacks. And it is possible, you guys. I swear to you, it is. It just takes a lot of effort. It's not as easy as just taking medication. But then once you come off, I know sometimes depending on how your body is, it can increase your panic attacks more. So it really just depends, okay? Now, you guys, I'm gonna be talking about certain tips that you can do. More tips in regards to just exposure and stuff like that is, so having a buddy is something that you can use as there's a panic attack coming. You might want to be left alone. I don't know. Everybody is different. I know that I kept hearing and then talking to my client. I know that when you go through a certain panic attack, sometimes, I mean, you just want to be left alone. I know I'm going to keep going back and forth towards like the person who's dealing with a panic attack and someone who is trying to help someone who's having a panic attack. But for someone who is trying to help the person, if they tell you to leave you alone and they need some space, you leave them alone. If they're not ready, you need to give them space, because I'm assuming that they're already implementing their own coping skills, which is a deep breathing, which is, you know, saying things over and over and over in their head or out loud that everything's gonna be okay. You see how I'm kind of going back and forth? For the ones that are dealing with panic attacks, closing your eyes, getting some water. But I will say that it does take time. For someone who's having a panic attack, you have to give them time until they're ready to talk. Once they're ready to talk, it is important for you guys to kind of go over what caused the panic attack, review how you can prepare for the next panic attack, and see what it exactly triggered it, so that you're ready and prepare with your coping skills, so it won't get you to a point where you are going to have a panic attack. Like, you might get a little anxious, but you're going to be able to control that anxiety, that it's not going to prompt an actual panic attack. Now, like I mentioned, for someone who's trying to help someone who's dealing with a panic attack, ask them, what do you need from me? Give them space when they need it. Ask them if they need water. Tell them, you know, do you want to talk about it? If they don't, give them space. Pause. So, my camera died, and I don't feel like charging it again. I'm just going to use my phone. Hopefully the audio's not as bad. You guys are already kind of used to me talking to you like this, so it's more personal. But exposure towards your triggers, really important, and that's how it helps you move on, because the more you expose yourself, the easier it gets, and you can practice your coping skills more, and you reinforce that, and it just becomes more and more easier the more you expose. And I know, you guys, because I've been exposing myself to cockroaches, and they terrify the out of me. It's helped a little bit because I've seen them around, and I'm like, all right, you know, I'm talking to myself like, it's all right, I'm not gonna die, you know, I'm okay. And I just walk on over, and I don't like yell or scream or get like really dramatic like how I used to. Baby steps, you know, because it's still like, it makes my heart like and I'm just freaking the fuck out. Like, it's horrible. So I can't even imagine someone else that might have it even more intense than what I get over. And my thing is just about a cockroach, like, but it's really bad. I was worried about myself that I freaked out that bad over a cockroach when that incident happened. But like I said, it prompted me to be more aware, and I was like, okay, I have to do something about it, because it was debilitating for me. Like, it took me about 30 minutes. That's one thing too, before I let you guys go, is it will take time for your panic attack to reduce. Whether if you're the one that's waiting for the person to calm down, be patient. It's gonna take time. And if you're the one that's going through the panic attack, be patient with yourself. The more you practice your coping skills and interventions, the lesser and lesser your panic attacks will last, and then hopefully you'll just feel some anxiety and you'll take control of that disorder, you know, panic, before it even becomes into an actual attack. So I really hope this video was helpful, you guys. If you guys are new to my channel, do not forget to subscribe. Don't forget to turn on the notification bell so you guys know when I put on my next video. If you are new to my channel is about mental wealth, and I integrate my life so you guys can get to know me and see how our own personal lives really intertwines with mental wealth and just in general. And, you know, to help my youth in a sense of whatever they're going through, because I see how hard it is nowadays with all this social media stuff. Thank you guys, and I'll talk to you guys in my next video. Bye.
Now I was lost.